Hi, everyone. Good to see you. I'm going to start, let's see what time it is. I'm going to start in about 5 minutes, so give everyone a chance to join. And it won't be too terribly long, but we'll talk about the COVID essay prompt and how to write a strong response. So I think everyone here knows me, right? Nina? Okay, and you also know that following this seminar, you have to submit a reflection statement. Okay, so make sure that you receive the link to that, and if you didn't, I can post it in the chat before I end the seminar, okay? And that's the only assignment you have to submit after this, just that one reflection statement, okay? All right, so make sure you have your charger, you're in a place with strong Wi-Fi, and we'll start in a couple minutes. All right. I think students are still coming in, but I think in the interest of time, we're going to get started. So this seminar, well, I see students already still coming in, but we're going to talk about the COVID-19 essay prompt and, how you should approach this short but meaningful essay and, what things to consider in writing the response. For many students who took some time off after graduation before applying to medical school, COVID definitely was part of their college experience. For students who, are applying as juniors, or even, currently, some of COVID could have been taking place while you were a senior in high school. And so your experiences there will be different, but we'll talk about everything. And I'm happy to answer your questions along the way too. Okay. All right. So as we all know, COVID-19 had a huge impact, not only on our world, but on your path to pursuing a career in the health professions. Certainly beginning in the 2020 application cycle, due to this impact of COVID on pre-health students, a new prompt was added to applicants who are applying to medical, dental, optometry, PT, and PA schools. And that essay question, which is no longer new, it was intended to give you that unique opportunity to speak about COVID-19 and how it impacted you and your application journey, so that admissions committees could have a better sense of all aspects of your preparation for medical school, dental school, etc., and just to learn more about you and your character as a person and some of the struggles or challenges or ways that you gave back during COVID. So just to give you a little bit of information about the COVID questions, because they appear in many different applications. Each application has a slightly different wording, but the character count is the same, which is 2,500 characters with spaces. And that's about half the length that you would have for the main personal statement. So you do have, a sizable chunk of space to discuss the impact of COVID and how it specifically affected you on your path. So for the osteopathic medical school application, ACOMAS, there are 3 questions. Did your school move to offering only online curriculum during the COVID-19 crisis? Hunter did move to an online-only curriculum from March 2020 to September 2021. And if you're getting a committee letter or a committee packet, that information is specified in the cover letter. So medical schools know when we, shifted to an online curriculum during that time. Did you have an opportunity to receive a letter grade for any of your courses taken during the COVID-19 crisis? And the answer will be yes. You could have chosen to take a credit, no credit when we initially went online for that semester, but you also had the chance to take the letter grade. And I know that we've always advised students, specifically with their pre-med or pre-dent requirements, to always take a letter grade for the class. So the third part of the question is, please describe how COVID-19 has impacted your pathway to medical school. These items to consider in incorporating in your response may include, but are not limited to, academic. Were you able to interact with your professors? Did your MCAT exam get canceled, delayed? Did you experience other academic barriers, such as a lack of Wi-Fi during online classes or difficulty finding a quiet place at home to study? due to crowded living conditions, resulting in a drop in your GPA. Professional considerations. Did you hold a job that let you go due to COVID? Did you have to go out and seek a new job opportunity because your family suffered financial setbacks due to COVID? Did you experience other financial or professional barriers, such as cancellation of in-person clinical or research experiences? And personal considerations. Did you or your family members contract COVID-19? I think at this point, pretty much everyone has had it, but I think this would specifically apply before the vaccine came out. And there was a specific concern that if you contracted the virus, that it could be very, very serious. Did you have to move out of a house or dorm? Was your community particularly hard hit by the pandemic? And many of you did or do come from communities that were definitely very, very hard hit. Did you struggle with issues of vaccine hesitancy in your family or community? Did you pursue new volunteer opportunities that arose from the crisis? Did you assist any family or community members that were affected? So these are all the kinds of things you should be thinking about and discussing. ADSAS application, they have this question that's contained in the personal information section under other information. The prompt is, COVID-19 has broadly impacted the world. If you want, you can use this space to describe how the COVID-19 pandemic impacted your preparation for the application to dental school up to this point. Each dental school will determine how responses to this question will be considered during the admissions process. Right? And then there are other factors that they include in the application to consider. Was your DAT exam canceled or delayed? Did you or your family members contract COVID-19, or did you lose family members due to the pandemic? Did you lose the ability to interact with professors or advisors? Did you move to online-only courses? What impact did this have on your academic performance? Did you have difficulty managing remote learning due to living conditions or poor Wi-Fi access? Was your clinical position, paid or volunteer, affected? Did you lose a job or have to seek new opportunities? Was your shadowing experience shortened or modified? Were your financial responsibilities shifted or increased? Other factors, did you work through the pandemic in a dental clinic? And if so, what did this teach you about dentistry in terms of the sacrifices and additional safeguards required to provide care? Okay. Did you have to help family members who were affected? Did you seek out new volunteer opportunities that arose from the crisis, such as ways to mentor young students who were struggling to learn online, ways to help those in need in your community, especially those who were immunocompromised or didn't have a lot of mobility, older individuals who were concerned about getting out and doing their shopping, dental, e-shadowing, or other virtual opportunities. So think about all of these factors. So I don't know if we have any individuals who are applying to PA programs, but the CASPA application also has an optional COVID essay. And again, it's 2,500 character limits with spaces. And again, it asks you to focus on, how COVID-19 impacted your pathway to becoming a physician assistant, right? So this application, you can choose not to write if you don't feel you were impacted. It's an optional essay. If you do choose to respond, you want to make sure you state the facts in a timeline instead of writing an opinion piece about the pandemic or what you learned about healthcare from your experiences with COVID. You can mention that to some degree if it impacted or informed your decision to become a healthcare provider or somehow informed you about certain inequities or disparities in care, but it shouldn't be primarily an opinion piece. For those students who are applying to optometry programs, OptumCast also has a COVID-19 essay. Okay, again, these are the things that they're looking for. How has COVID-19 impacted your pathway to optometry school through your academic, professional, and personal life? And how have you responded to these changes? And again, also for those applying to physical therapy graduate programs, similarly, there is this optional essay for you to focus on your educational, your personal, or your professional impacts that COVID had on you. So this is something that you will see, many different individuals on many different paths to healthcare having to focus on and write about, especially if you were faced with loss of loved ones, especially, during the time before there was a vaccine, or any specific circumstances that really caused you some hardship or setback. So interestingly enough, the AMCAS application did not add a specific prompt to that main application. However, there are still opportunities to write about the impact of COVID-19 on your path to medical school. You can include COVID in your personal statement, but we do not recommend it unless you or a family member were on the front lines treating COVID patients, or you had family members who were essential workers in some capacity, and it strengthened your resolve to pursue a career in medicine, or you lost loved ones due to COVID, and this impacted your decision to become a physician. You can also include a separate experience description of how you were impacted by COVID. And this would be especially appropriate if you provided some sort of service during the pandemic in some capacity. You will also have, opportunities in many of the secondary essays. So even though there's not a prompt in the main application, you will see many schools in their secondary essays, including a prompt about COVID. So what is this prompt really asking? It's clear that you need to reflect on how the COVID-19 crisis impacted you in 3 ways, right? Academic, professional, and personal. And in addition to being able to articulate how the pandemic impacted you in these 3 ways, you're also going to need to indicate how you responded to these changes. It's not just articulating what happened, but how you dealt with these changes, how you adapted, how you overcame these changes. Demonstrating how you adapted will be equally important to articulating how you were impacted. So you want to focus on personal growth and service. Although this essay is asking about the specific setbacks you have encountered because of the pandemic, you need to state the facts as they occurred without real additional commentary. This is not a creative writing piece. And I think some students tend to be overly creative or dramatic in the way they describe the impact that the pandemic had or some of the circumstances that they were dealing with. But if you indeed did have challenges as a result of the pandemic, you need to write about them, and you need to state them in a very factual way. Indicate how you adjusted and adapted to your new circumstances. Indicate the forms of service to others that you undertook to help your community. And it's important to include a timeline. Don't just say that your father was laid off from his position during the height of the pandemic, and you had to take on additional, either, cut back, or you would also take on an additional job to help out with family expenses. Give the month and year that your father was laid off. Indicate what his position was and what he was laid off from. Be very detailed. Indicate the job that you undertook, how many hours a week you were working, what exactly your roles were in that position, okay? And maybe it also impacted time away from your studies because you had to help to support your parents, or maybe you did other things online, virtually, tutoring, but be specific and very detailed in what you were doing. Don't just mention it in a very broad stroke way. And this is going to be most helpful to admissions committees when reviewing your application, because it's going to be another window into your character, right? It's going to show admissions committees you are someone who was committed to helping your family, to achieving your goals, to doing well in your studies, and the steps that you took to, to adjust to the changes. Okay. So let me just continue here. So every applicant's story is different, and we know that. But you want to focus on your individual story. Don't compare yourself to others. Did you contract the virus? What was your experience? Did members of your family contract the virus, immediate or extended family? How serious was their illness? And remember, this is most relevant before the vaccine. Did you face instances of vaccine hesitancy in your family? And how did you handle this? And many of us, many of you may come from communities where there was quite a high degree of vaccine hesitancy. And maybe you had to, in some way, educate your community, your family, to make them comfortable with the vaccine. And how did COVID-19 impact you or your family in terms of loss of income? You do want to avoid taking the role of the victim, okay? So you do want to state the facts, but you don't want to come across as woe is me or seek pity for your situation. You can acknowledge that as bad as the situation was for you or your family, you know that others incurred great suffering. Of course, the pandemic presented new challenges in terms of transitioning to remote learning platforms, issues with Wi-Fi access, especially if you share a home with others who are online at the same time. Certain individuals were also dealing with test cancellations, but that issue, should have not been one for those of you who are in the current cycle or planning to apply next year. So you just want to focus on the challenges and how you persevered and overcame them. So the COVID essay, while giving you an opportunity to talk about some of these hardships, it shouldn't be a space for you to discuss deficiencies in your application, okay? This is not an essay about providing excuses for why you didn't do certain things, right? If there are parts of your application that are lacking and not a direct result of the impact of COVID, definitely do not discuss them here. For example, you can include your concerns over choosing to take a credit, no credit for a class due to difficulties with online courses, shadowing opportunities you lost, or the cancellation of study abroad or other volunteer service trips outside the US. But you would not want to include instances that are not directly related to COVID, such as poor grades received, excuses for being significantly under the recommended required patient care experience hours, or having 0 shadowing hours, right? So I think some students were under the impression that if they dealt with the hardships of COVID, somehow there would be, their application would be looked upon more leniently, and that was not the case at all. I think, if anything, medical schools felt that if it took you a little longer to prepare to apply because of the setbacks that you experienced during COVID, they encouraged applicants to do that. And of course, this is a great space to talk about what you did to help others during COVID. My hope is that you just didn't lock yourself in a room and, only focus on yourself and your family, that you were able to find ways, even virtual ways, to do good for others, because so many people were affected. Did you collect food to donate to those in need? Did you volunteer to go to the store for your elderly neighbors or run errands for healthcare workers? There were so many different ways to help. Did you provide virtual tutoring or make masks or volunteer to handle calls for a crisis hotline? You definitely want to use this space as an opportunity to show your perseverance through this difficult, unprecedented time and your continued dedication to a career in healthcare. Many of you, I think, were also COVID swabbers at some point. But how did you make a difference? What did the pandemic teach you about community and helping others? Did you continue to work in a healthcare or research setting, either in person or virtually? What risks to you or others you live with did you incur as a result? Did you find ways to help the elderly or essential workers by calling more often, offering to pick up food or run other errands? Did you find ways to tutor students virtually or volunteer at a food pantry or crisis hotline? Right, so there were so many organizations, COVID sitters, helpers for COVID. There were many ways to demonstrate service. And what did you learn about COVID-19? How did you educate yourself about the virus? What were your sources of information? The CDC site or other medical publications? Many, I'm sure, in your community were educating themselves by social media, and much of that information was, questionably accurate. What did you learn about public health? What did you learn about the social responsibilities of being a healthcare provider? What did you learn about the practice of medicine and what it means to be a healthcare practitioner? You need to reflect on how this impacted your decision to pursue a career in healthcare. Did it make you more motivated to serve? Things to avoid: don't criticize the government's response. I know this is many years after, but you may have had bad experiences. This is not the place to be critical of medical practitioners or other healthcare workers. This is also not the place to give your personal views on what went wrong or what could have been handled better. We also do not recommend you discuss your political views. And if you're applying to be a healthcare practitioner, provider, we also advise never to speak negatively about the health profession or to come across as if you are the expert and know more than clinicians with many years of experience. I'm not denying the fact that you may have had a negative experience with a particular provider or a situation where you felt that someone's case was dismissed poorly and they were sent home from the hospital only to get much more ill with many more serious complications, even death. And you can mention this factually, but I don't think this is a place to go into, you know, a real, openly critical piece about the healthcare profession. You can acknowledge your awareness of systemic issues in healthcare, such as cost, lack of access, or other inequities, but I don't recommend that you write about a doctor who mishandled a patient case. And as I mentioned before, this is also not a way to excuse yourself for any deficiency in your applications, right? So I know we all struggled to transition to online learning, and for many, it was very challenging. But you can't use that as an excuse for, why you did very poorly in a particular course, or the reason why you don't have research or sufficient clinical hours, or the reason why you couldn't get strong letters of recommendation. Of course, you can state there were missed opportunities due to the pandemic, but you can't use it as an excuse for not having as strong of an application as you had hoped. And don't focus on irrelevant topics here, right? So this is not the place to mention that amazing trip to Europe you were able to squeeze in right before the pandemic hit, or how lucky you felt to spend more time with family members, time that you would not otherwise have had the chance to do if you were still required to maintain your busy pre-medical, dental, PA, or optometry schedule, right? I think we all made significant life adjustments to our new life situation, but that's not really the focus of the essay. However, if you had to live in an abusive or cramped home environment, you can mention this, right? Because I'm sure it impacted your ability to study and stay motivated. A word about mental health and wellness. We know COVID definitely had an impact on the mental health and wellness of many. If your mental health suffered as a result of the impact of the pandemic, you can definitely discuss this hardship if it impacted your academic, professional, and/or personal performance and interactions during COVID. However, it's equally important to discuss how you found ways to improve your mental health and to implement wellness efforts to manage stressful situations. Health profession schools want to know that you can handle the stresses of a rigorous academic training program and a career in healthcare, so they want to know how you adapted and grew from these mental health challenges. If you experienced just generalized anxiety and stress as a result of the pandemic, I think that's similar to mostly what everyone experienced. I don't think that's something to focus on in the essay. I mean, I think we all were under a great deal of anxiety and stress just generally. But you can talk about how you found ways to manage that anxiety and stress. As I mentioned before, the pandemic definitely did not lower standards by medical admissions committees or other committees. And in fact, I think because of the pandemic, there was an increase in applications to the health professions. So this is a chance to tell your story. State the timeline of events in terms of dates and occurrences. Be as specific as possible, as I mentioned, in terms of the date the classes moved to an online platform, when other activities that you were taking part in were postponed or switched to an online format. If you were in high school when this happened, you can talk about that as well. It's not just college. You can talk about your time in high school and how that was impacted. Explain the specific challenges and struggles you face, but most important is to demonstrate personal growth and a greater resolve to enter your chosen healthcare field because of the new perspectives that you gained about healthcare, medicine, research, and access to care. You want to show your resilience and your resourcefulness. These are key qualities and competencies that all health profession schools are looking for. So indicate how you grew and how in the future you will be a better clinician because you've lived through this unprecedented global crisis. Indicate how you adapted to survive and to excel in moving towards your goal of becoming a physician or a dentist, physician assistant or optometrist. And you can demonstrate that you've gained the competencies necessary to pursue your profession in unique ways. And the pandemic certainly was one that challenged our perseverance and our resilience. And, there were unique ways to demonstrate your preparation. There were opportunities to take part in e-shadowing. If you did that, you can talk about what you learned in the process when your clinical opportunities were closed. When research labs were closed, there were students who were able to either continue their research on a virtual basis or to take part in other research projects on a virtual basis. So if that was your situation, you could talk about that as well. And if you identified needs in your own community that you felt it was important to respond to, you can discuss that as well and how you responded to them. Perhaps you developed a new interest in community health or public health, and you pursued this interest, or you plan to pursue this interest in the future. Now, in terms of secondary essays, as I mentioned, especially for medical schools, allopathic medical schools, there will be many secondary essays that are going to provide a place to speak about your experiences during the pandemic. And these prompts can serve as a means to write about how you were impacted. They may come in different wording. One might say, tell us about a time you experienced adversity and what you learned from this experience. Talking about an experience during COVID-19 and the pandemic is definitely something that could be considered a topic for you to write about. Some secondary essays will say, is there anything else that you would like the admissions committee to know about you that is not otherwise disclosed in the application? Maybe you had a relative who lived with you, or a parent who was an essential worker, or someone who was on the front lines. And you can talk about your experience, how this, the various difficulties you had, perhaps them coming home, having to disrobe, to shower, to make sure that they didn't infect anyone else in the house. So you may have different specific experiences related to COVID that you could use to answer this prompt. I'm not saying you have to talk about the pandemic in response to this essay question, but it does give you an opportunity to use this prompt as a way of talking about your experience during the pandemic. And certain medical schools do have specific prompts about COVID-19 and how you were impacted. And of course, it's always, always, always important to conclude on a positive note. Find a positive among the negatives. Has the pandemic given you a greater appreciation for healthcare providers and the sacrifices they make for the greater good of the community? If so, discuss how this fact makes you even more excited to join the ranks of healthcare providers one day. Did the restrictions imposed by the pandemic spark your creativity in terms of finding new ways to contribute or to connect with others, or otherwise opening up a new way to help your community? Admissions committees love applicants who make lemonade out of lemons and leave things better than they found them. So think about that in how you conclude your response. A final note, I always say, it's really, really important to stay humble. Remember, you're going to be compared to everyone else who has lived through the coronavirus pandemic, so always stay humble and grounded. A positive tone will serve you well in all of your essays, including the COVID-19 essay. All right, and that, as I told you, was rather short and sweet. For those of you who entered late in the seminar, just remember to submit the reflection statement that you received when you registered for this seminar. If you want, just give me a hands up if you need me to share that link again, or you have it. Everyone has it. Great. Awesome. That's wonderful. Love that. Okay. Questions? Anything at all? Benjamin, you can unmute.
Yeah. I didn't, this question isn't related to this meeting specifically, but I just wanted to know about, when we have that, letter of good standing, you guys can't check for that, right? We have to make sure that we, like, if we already got it,
Well, if you requested it from Arthur Ford,
yeah,
yes, he automatically sends it to us.
okay, I just wanted to make sure.
Yeah, you don't have to worry about that.
Okay, thank you.
Sure. Menatala?
Yes, hi. I was wondering if you can send the link for the reflection statement.
Okay, I will put that in the chat. Nicole?
I was wondering, so we're about 5 years removed from the pandemic. How often do you actually see the essay coming up in our secondary applications now?
Yeah, so some schools still have it, and if you were in high school at the time, you can talk about, oh, the drop down on the reflection does not have the option to choose the seminar. Oh, okay, that's a good point. I will let Camille know that right after we end the seminar and she can make an adjustment. Allison, would you mind just putting that link, since you have the link, would you mind just putting it in the chat so I don't have to stop and get it? And I appreciate it. So yeah, I mean, you can talk about experiences in high school, and that's fine. And I think for some students, well, even if you were in high school, I mean, there were definitely ways to take part in your community, help others. And I think pretty much all of us probably had some impact on our experience. Maybe we didn't feel as well prepared for college because we were pushed through certain courses, or you were going to take part in certain research programs or summer internships that were canceled, or there were many who still did a lot of volunteering in the community in high school. Maybe those programs were canceled. Um, I- you know, I, I think that, I'm wondering, like, if next year this will still be, included in the application, but it is still there now. So it is it's worth reflecting on.
Thank you for answering.
Yeah, thank you. Anyone else? Okay. Right. Well, I always appreciate seeing everyone here. Um, and, many students always talk to me, they say, well, I talked a little bit about like, my personal statement. I talked about COVID, or how it impacted my family. Do I have to talk about it again in a secondary essay? And I think the key is, as in a lot of the experiences we talk about, it's about looking at it from a different perspective or speaking about it in a different way. How we include it in our personal statement, if we do. I'm not saying you need to, but if it is in some way in your personal statement, perhaps you can reflect on it from a different perspective or in a different way. Or even if you speak about it somewhat generally in your personal statement, you can talk about a specific story in the COVID essay. So there are always ways, I think, to reframe, restate, or state in different words an experience without, repeating verbatim what you wrote either in a personal statement or an activity description. Okay. But hopefully everybody, even if they were in high school, did in some way try to give back, either by doing tutoring or helping out their relatives, or doing something. Okay. Well, it was good to see everyone, and thank you for being here today. All right. Have a good day, everyone. Bye-bye.